women are essentially drinking themselves to death over the past 2 decades, as alcohol-related deaths among women are going up at a faster rate than they're going up for men. It spiked especially among women ages 35 to 44 during the pandemic. So that's like your millennial, if you will, your elder millennial. Deaths went up by 42% between 2019 and 2020. Let's bring in Dr. Natalie Azar. Why is this happening? Because I think that some of these statistics, some of these numbers might be startling for people who don't realize that this is something that so many women are dealing with.
Oh my gosh, absolutely, Hallie. Well, look, I mean, if you think about simply why this is happening, one of the major reasons is that, drinking in women has been normalized. The percentage of women aged 18 to 44, let's say, who are binge drinking is about 18%. The risk of liver disease is associated really with the amount that you're drinking. If you think an average serving, Hallie, of alcohol, it's about 12 ounces of beer, 5 ounces of wine, 1.5 ounces of a liquor. That's greater than 10 servings a week for women, greater than 15 servings a week for men, puts you in that red zone where you are at an increased risk for developing liver disease related to alcohol.
What should you look for? Like, in other words, if it's somebody that you know or love, as you, a doctor, Dr. Natalie, like, are talking to patients, and specifically, obviously, women patients, what are the kinds of conversations that you're having, and how are you framing that discussion?
So you ask a really important question, and I want our viewers to understand this.
Yeah.
Early liver disease related to alcohol use is completely asymptomatic. You can have what's known as fatty liver, and you would not even know that. As the liver disease progresses, of course, you can have other symptoms, hepatitis, jaundice, and obviously cirrhosis, and eventually, liver cancer. But it's about asking the questions. You have to ask the questions about how much people are drinking. You may assume once in a while, Hallie, that they may not be completely honest and truthful with you, but it's really about open communication and really expressing to the patient and making sure that they understand what the guidelines are and the potential risk factors on liver, brain, heart disease, certain cancers, and in addition to violence and whatnot against women.
What you're talking about, though, takes two things. It takes trust and it takes time. And one of those resources can be in abundance with doctors and patients, and one of those resources, specifically time, can be not in abundance, right? And it feels like that's part of the trickiness.
It is. I mean, if you think of all the things that we really are supposed to review with a patient in a patient encounter, but it is so important, and something that we all try to do in our daily practices, speaking with our patients. But it's important, and I'm glad that you wanted to do this story tonight so that we could bring attention to it. It's so very important for us.
Dr. Natalie Azar, we're so glad to have you on to talk us through it and to help shine a light on it as well. Thank you.
Yeah.
We should note that if you or anybody you know is struggling with substance abuse, help is out there. It is available at 1-800-662-HELP. You see it on screen, 1-800-662-4357. Let's get you over to the